Welcome to my channel. Today's topic is dentin hypersensitivity. What happens in dentin hypersensitivity? When we eat something cold or heat, there occurs a sharp sensation in our tooth. Here person feels a short, sharp pain for few seconds. Now what is the reason of this pain? When our dentin comes in contact with cold, thermal, tactile or chemical or osmotic response, there occurs passage of a stimuli in the exposed dentin. Then there occurs a disturbance, which affects the normal flow of stimuli. The pressure in the fluid changes due to the disturbance. So basically dentin hypersensitivity is defined as short, sharp pain arising from exposed dentin in response to cold, thermal, evaporative, tactile, osmotic or chemical, and which cannot be described to any other dental defect. Now coming to incidence and distribution. 15 to 18% of general population are affected by dentin hypersensitivity. Dentin hypersensitivity mostly affects between 20 to 40 years of age. Here is an important point. Gingival recession is the main cause of dentin hypersensitivity. Now, what is gingival recession? Gingival recession, also known as receding gums. It is defined as the exposure in the roots of the teeth caused by a loss of gum tissue. Or it may be due to retraction of the gingival margin from the crown of the teeth. Females are more affected than males. Diet plays an important role in this. Buccal cervical area of teeth is mainly affected. Because mostly gingival recession occurs here, and enamel is thin in buccal cervical area. Here is the picture showing buccal cervical area. Most commonly affected tooth are canines, first premolar, second premolar. There are three theories which represents dentin hypersensitivity, in which two are rejected. So, first one is dentin neural stimulation theory, which is the rejected one. Second one is odontoblastic transduction theory, which is also the rejected one. Third one, which is most accepted one, is hydrodynamic theory. We will discuss one by one. According to this theory, whenever there is injury to these dentinal tubules, the stimuli reach the nerve endings and the stimulated nerve causes dentin hypersensitivity. Exactly what happens in this theory? Dentin hypersensitivity occurs due to the direct stimulation of nerve fibers present in the dentin, which extends up to 100 micron along with dentinal tubules. Now coming to mechanism. What happens? Mechanical, chemical, osmotic stimuli comes in contact with dentin or pulp, which causes a direct stimulation of nerve fibers in dentin or pulp. Because of the activation of nerve fibers in dentin or pulp, there occurs a painful response which leads to dentin hypersensitivity. But this theory got rejected. Why? Before going to this, we should know that dentin contains outer dentin and inner dentin. Outer dentin is devoid of nerve fibers. Despite of that, outer dentin is more sensitive than inner dentin, but why it is more sensitive? Because peritubular dentin thickness is less in outer part of dentin. So the odontoblast and mainly the tubules are easily stimulated in outer pane than inner, which causes fluid movement, which is main reason of nerve stimulation. Another drawback of this theory is newly erupted tooth, they doesn't possess nerve endings even though it is sensitive. Because of these reasons this theory got rejected. Now coming to the second theory. The odontoblastic transducer mechanism. The second possible explanation for sensitivity of the dentino-enamel junction in the absence of peripheral nerves would be if the odontoblast process could serve as a sensory receptor. This would require that pulpal sensory nerves form synaptic junctions with odontoblasts. Destruction of odontoblasts did not cause dentin to be insensitive. If odontoblasts served as sensory receptors, such dentin should be insensitive. In fact, such dentin was even more sensitive than normal. Careful transmission electron microscopy of nerves touching odontoblasts failed to demonstrate the required modifications to the plasma nerves in the odontoblasts if they were true synapses. As there is non-neurotransmitter vesicles present in the gap junction between odontoblast to facilitate the synapse or the synaptic transmission, this theory got rejected. The hypothesis that odontoblasts serve as sensory receptors and contribute to dentin sensitivity has largely been rejected. Now the most accepted theory, that is hydrodynamic theory. This theory was given by Brøndström. The hydrodynamic theory of fluid flow, also called as hydrodynamic stimuli. It include hot and cold, tactile, evaporative, and osmotic stimuli. Their final common path is fluid movement within dentinal tubules that interactivate mechanoreceptors in intratubular nerves or in the superficial pulp. Because of the activation of mechanoreceptor, the true physiologic stimulus shifts either inward or outward fluid. There are two essential elements of the hydrodynamic mechanism. First one is fluid flow through dentinal tubules. Second one is the dentinal tubules and mechanosensitive nerves in the pulp. Here is the picture showing mechanism of hydrodynamic theory. Stimulus like thermal, chemical, osmotic passes through dentinal tubules, they distribute dentinal fluid flow. After that there occurs generation of action potentials in nerve endings. After that action potential transferred to brain causing pain. After this coming to causes of dentin hypersensitivity. What is the cause of dentin hypersensitivity? Firstly, the primary cause for dentin hypersensitivity is exposed dentinal tubules. Other causes can be loss of periodontal structures and loss of enamel. Now what are the causes of exposure of dentin? Dentin may become exposed by two processes. One is lesion localization. It occurs due to enamel loss and gingival recession. Enamel loss occurs due to attrition, abrasion, erosion, abfraction. Gingival recession occurs due to faulty tooth brushing, periodontal disease, self-inflicted injury. Poor oral hygiene also lead to gingival recession. Second one is lesion initiation. Here opening of dentinal tubules occurs. Loss of covering of periodontal structures also lead to exposure of dentin. Some other causes of dentin hypersensitivity are change in temperature, the careless use of scalers, fracture of enamel, action of salt, sweet, and acidic substance. Extrinsic acids or intrinsic acids causes erosion, which leads to dentin exposure. After that there occurs opening of dentinal tubules. After that the distributed its A delta fibers, which leads to dentin hypersensitivity.